Hello and welcome to our Friday webinar. We are on with Dr. Tom Tully. Welcome, Dr. Tully. Hey,
Hello, hello.
is this our
It's
first Ask the Vet
February.
with you this year for 2024? Did we? Yeah. Did we do it
Yeah,
in January?
is this the first one, right?
I
For
think so. I mean, we have done so many Ask the Vets, and this is
yeah, well, Valentine's Day's over, Mardi Gras is over. It's
that's right. Now
I
we're
think
into marching
everybody's
into.
looking for spring. We have flowers blooming here in Louisiana, so I mean, it's good. It's good.
Very nice. Yeah, we kind of with the rain we had in California, we are getting some blooms here. I'm sure in the next any day now.
Yeah, well, you've had a little bit of rain, huh? You know,
Yes,
the
it's
drought's over, huh?
kinda. We'll see. We'll see how we maintain this.
For the time being, right?
The time being, yeah. My bird can have an extra long shower.
I love it. I love it. Good
Uh,
deal.
yeah, so I was just having some cup of Joe, and I was just thinking, I see like a lot of videos on Instagram. I watch some Instagram videos. I follow a lot of like, especially, the bird content, but you see a lot of videos of like mischievous birds crawling up or climbing up and like taking sips out of the cups on the tables and stuff.
Yeah, yeah.
So
Oh,
like someone looked like coffee mugs, and I was just like wondering, like what if my little budgie friend here, he doesn't like coffee, but if he came up, I mean, would that be like something that's really concerning if you
well, I mean, if his eyes get really like, like, whoa, yeah, the caffeine kicks in. Yeah. No, I mean, that's no, not
I
any
mean, you ever
issue. I
seen?
don't, just in moderation, right? Drink in
Okay,
moderation.
yeah, I'm thinking like cocktails, like
Yeah. Mhm.
those maybe have you ever had to treat a bird that like walked around at a party that
For a
just kind of
hangover.
yeah
No, I haven't, thank goodness. But I think that a number of my colleagues, I I think maybe we have had one or two cannabis toxicities,
for
but
birds.
the birds seem to have recovered, and there's been some presentations on that at the AAV conference that is coming up in Kansas City. Looking forward to that. But no, but there have been some presentations on that. But alcohol, no, not really. But a sip or of coffee, what have you, that's usually not problematic. Not
Okay,
problem. So that's good. That's
as long as
good.
they're not
If
like a
it's
day.
good coffee, if it's good coffee. And, and the coffee is directly how good it is. It doesn't that directly correlate to how much it costs?
That's true. Yeah,
The
probably.
better the coffee, the more it costs, right?
Yeah. Yeah, you're right. That's what's just
Uh,
think if you brew at home, just think how much money you'll save to buy your bird like a lot of enrichment toys and better diet. So there you go.
that's
There's a
it.
reason to brew at home right there.
That's it. But good to have you back. We missed you last time.
Oh gosh, yeah, it's good to be back.
We're a little under the weather, as they say, but glad to have you back.
Thank you. Thank you. Okay, so I'm gonna try not to slay any medical terms today. I promise. I'll do my best. That so I do have a question for you.
Wait. Before we start, um, it was there was a question and that was here before about LED lights and they say that do LED lights flicker like uh, fluorescent lights? And I guess you can look at that and you can go into electrical engineering into great detail, which most people do not. But are they a continuous light or do they flicker? And there's a lot of really esoteric engineering in there and some debate, but in the end, it appears that they do have some flicker as opposed to continuous. That's what I'm getting. But as far as the perceptibility or the problems with that, and again, birds have been under fluorescent light, and I don't think that we're looking at significant health issues as it would relate to that. If it's I don't believe from what I'm to read that the LED lights have the flicker as much as the fluorescent lights do. But if you were looking at it from what I'm to understand is that they do, but it's very not as much as what the fluorescent lights do. So that was a question, and I wasn't really sure last time, looked into it, but in the end, if you have a fluorescent light that does, and we're not looking at of course we turn the lights off. We don't we don't have a 24-hour lights, but I don't believe we're going to see any significant health issues that are associated with it. And I haven't seen any that I'm aware of that can be directly correlated to lighting, fluorescent lighting. But if you want to put LED lights, they can be pretty bright. That would be more of a really bright light would be more of a concern than anything. But no, I wanted to just to kind of clear that up. That was the question last time, which was a good one.
Yeah, I could tell it kept you up all night. You got
Well,
back.
I mean, yeah, it did. It was bright. It was a bright question.
Oh, man. All right. I got to, there's our first question of today would be, is it okay to keep parrots near other birds like finches and quail? Not in the same cage, but is there a disease that can be transmitted between the bird species?
Well, I mean, there's, just like us, right? I mean, even, there's diseases that can be transmitted between animals and the two other animals and people. And so there are diseases, but as it relates to a significant diseases, there's none that I'm aware of. I wouldn't say having quail in the same cage as the parrot would be a good thing. I know that people keep quail. You could keep them, but the birds may interact, and the parrots may not like the quail, and that may be problematic. I know that people have had quail under flight cages that are suspended, and I don't see any issues there. If the birds are healthy, that's fine. Most of the parasites and things are that the birds would have would be in contact, and they would have to either come in contact with the ground or a intermediate host like a snail, an earthworm, or something like that. So as far as infectious diseases, no, not necessarily. Whereas, you have smaller parrots, so you're looking at finches and quail were the two examples here. But you have budgies. Budgies are subclinical carriers of polyoma virus. So that's something that if you have budgies with other birds, that may be somewhat of a concern. And of course, they're not the only bird that can be subclinical carriers, but it's within, and people don't test for budgies with polyoma or vaccinate or what have you in most cases. But that's a bird you could have with other larger birds that it could transmit. And it's not necessarily polyoma I'm talking about. It's not necessarily a mature bird problem as much as if you were raising baby birds, and that's more of a problem in larger parrots. And then of course you have beak and feather disease, and we've seen and we haven't seen that in larger birds for a number of years with the testing that's available. But it's out there. It's out there. And so beak and feather disease, that is within lovebird. If you have a number of lovebirds or lovebird, Indian ringnecks is another bird that are subclinical carriers, and they can have the disease. And if you have larger birds, these birds can transmit to other parrots. So it's an interesting question. And you think, well, if I have another parrot with a parrot, that's fine. Well, it's if it's healthy and it doesn't have any diseases, that's correct. But I think more of a problem is not necessarily finches, because there's not necessarily a lot of finch diseases that we're going to be able to, to transmit to your parrots, but it's parrots to parrots that you have to be more concerned about if you want to put parrots together, that the parrots could transmit a disease that it's not necessarily problematic for. Avian chlamydiosis could be one too, where the bird is a subclinical carrier, not having the disease, but transmits it to another bird that is susceptible. So this all kind of goes back to, if we want to call it One Health, within the parrots that you have.
Community health.
Yeah, community health. That's right. That's right. So it's a good question, an excellent question, but the importance is not necessarily, with your quail that may not come into contact with them, but around the birds, maybe under the birds in the aviary, picking up food and everything, or finches that would be in the same room or something. But it's the other birds, other parrots that are possibly more concerning, if you will, if you don't really know what, the health of those birds.
Okay. Is that like so that if you have more than one bird, that it might be even more important to bring them in for checkups, so that if one gets sick, you can kind of.
Yeah, that would, if you have lovebirds and you have other birds in there, it would be good to know that if those lovebirds are negative for beak and feather disease, they could be subclinical carriers of or subclinically infected with circovirus. Don't know it, but Indian ringnecks, that's another one that is that seems at this point in time, the Indian ringnecks, the circo is a problem, at least in our area.
All right. Let's see. We got a question about vet. Says my vet would give Benebac gel for birds along with antibiotics. Pet ag stopped making the bird/reptile gel and said to check with the vet to see if their other gel can be used. So they're noticing a difference between is the fourth ingredient. It has dried lactobacillus casei avian strain fermentation product. Avian strain is specified. In the regular mammal strain, it's not listed.
Yeah. And therein, I was just at the Western Veterinary Conference last week, and I talked to somebody at Pet Ag, and really wasn't the person that had worked at Pet Ag for quite some time, but was nonetheless employed and was at the booth. And I had mentioned that because I had heard that that Pet Ag had stopped really manufacturing the avian. And I think that they had, where with the avian, what they had promoted for their avian product was also for other animals too, like maybe reptiles. But the one thing that I would say about the probiotic, and even before, there was Benebac, and there was also some other probiotic supplements for birds that was a powder, and I don't believe they're making that anymore. But is that, we would recommend like yogurt, as a somewhat of a probiotic. The problem that you would have with say supplementing a say a probiotic, something that you would have a good beneficial bacteria to enhance the microbiome within the intestinal tract, that really, for a good probiotic to work, you need to be species specific. Okay. So consequently, if you are transfaunating a human, you would use human feces, okay? And that is done, all right, in certain situations where that's needed. In rabbits, you would need rabbit feces. A blue and gold macaw, you would need blue and gold macaw bacteria. African gray. The problem is that there's over 10,000 species of birds, right? How many, we have a number of species of citizens. Usually you don't have one that you are transphonating the other with, as far as probiotics, to try to get the good bacteria in there. And of course you'd want to transphonate from a healthy individual, not a ill individual. So it's the good bacteria. And that would, so with the probiotics, you're, or transphonating, in a sense, you're putting good bacteria in to do a number of things. One is that you're putting good bacteria in there, okay, to increase the numbers of good bacteria in the GI tract. Number two, you're trying to enhance the environment of the intestinal tract that the good bacteria will grow, okay? Also, what you're trying to do is to, with the good bacteria take up sites within the intestinal tract that on the villi of the intestinal tract that will help repel and also prevent bad bacteria from taking up residence there. So this is all of the things that you're looking to do for when you're given a probiotic supplement. And that's why, if it's going to work the most efficient and the best that it can, you want that particular species of bacteria to be given. With the commercial products, they can't have it's not economically feasible for them to have a blue and gold, cockatiel, African gray probiotics. So therefore, what's the most common bird out there that they can collect these samples from? Chickens, right? And so they could use chickens. And of course, everybody on this webinar knows that chickens are not parrots, right? and but they are a bird. And so that would be the avian bacteria that was in the commercial product. And that would give the animal the best chance of having the best results with the probiotic supplement. Will other bacteria, they say it's good bacteria, will they enhance the GI tract? Will it help the bird? Will it help promote good bacteria that's there? The environment, will it, like if you gave yogurt, well, the cattle bacteria is not going to thrive within a bird environment, theoretically or physiologically, but it may provide the environment for the bacteria that are similar to get better. It may provide some benefit. That was the hope. It was a hope that the chicken strains of lactobacillus would be beneficial, and even be more beneficial than the cattle strains that you would have in a yogurt, let's say. So that is what is kind of the basis of probiotic supplementation. That's the basis of the commercial product. When it said avian strain, it's chicken, okay? But it's not species specific, but hopefully it would have a better effect than a bovine product. And now that's off the market. And so the question is, will the other products work if you don't have an avian probiotic supplement? It would have the possibility of working as much as yogurt would. I don't, you're not going to have any negative effects that I've never heard of any, somebody having negative effects with yogurt or having negative effects with any of the probiotic supplementation. I just think that your expectations for how well it would work or could work have to be, suppressed, simply because knowing, really what is effective is not there. And so that's the issue or the problem, and what Pet Ag had manufactured. And again, we did research with their avian product and found the gel seemed to have a better effect than the powder, not a lot better, but it did seem to be better. Maybe it was just the bacteria, where it was a better environment for the bacteria to be in the gel as opposed to within a powder. But nonetheless, we never saw any side effects, but they had been manufacturing that for many years, back 1980s, I know, but it may have been a situation where they just weren't getting, it wasn't enough return on that production. But I don't know why they the gentleman I talked to did explain why they stopped manufacturing it. But now they have a product. I saw the product. It had a dog, a cat, a rabbit, and something else on it, but
not a bird, just
not a bird or a reptile. So and so I wouldn't be very hopeful that it would be that effective in what you would want to be doing, as I mentioned, what a probiotic should do.
Okay. All right. There you go. We have a question from Gloria about atherosclerosis diagnosed in the first treatment that would be recommended. So how is it diagnosed, and what would be the first treatment to start with?
Well, I would say, as far as atherosclerosis is concerned, and the first treatment, it would be similar to, say, a human. Okay.
Yeah.
So what's the first treatment for a human for atherosclerosis? You know?
Asking me?
So,
I don't know. Asking you.
so atherosclerosis. So we have a number of excellent attendees at this webinar, and some people may be familiar, some people may be, you know, may wish they weren't as familiar with it as others, but it's basically the deposits that are formed in the vessels, in particular arteries, heart arteries that block it, block these arteries, and often if they block totally, heart attacks. And in birds, it can occur in coronary vessels, but often we see it in larger vessels, the aorta that comes from the heart, or the vessels that go from the heart into the lungs. And so the question is treating. Now, the one thing that you look at is that when is it diagnosed? That's the one thing we're looking at, Laura. So in humans, anybody that's over 50 probably has atherosclerosis. Okay. And people that it's genetically susceptible probably have it much younger, unfortunately. And so what's the first treatment for atherosclerosis in humans is back to that question, you know. And many people are probably going like, well, I don't know. You know, it's not like we have a treatment for atherosclerosis. What do they say? Mainly what they're looking at is preventative, right? And so then you look at, say, well, atherosclerosis, what's that associated with? Your cholesterol levels. What's your cholesterol levels? Let's measure cholesterol levels. Well, you can, and in humans, they've over the years, through many millions and possibly billions of dollars of research, they fine-tuned the cholesterol levels in humans to try to determine what is good cholesterol, bad cholesterol, levels of cholesterol that would be associated with the formation of these deposits within the vessels. Birds, we just don't have that information. So it's hard to say for a bird that's young what the level of atherosclerosis is if there's no clinical signs of disease. And so, you know, there's no heart issue, you know, the heart's, you know, you do a cardiology consult, the heart's fine, bird's fine, you know, but those deposits are there. You just don't know it. And in humans, you say, well, you could inject dye. You could inject dye, and you could look at the dye, and they could run a catheter up the femoral artery, and then or a vein, and then up into the vein into the heart, and they can inject the dye, and they can see where these these areas are, which is fantastic. It's wonderful that we can do it. We can't do that in birds. It's very difficult to even diagnose atherosclerosis, where even if a bird's showing signs and it looks like it, walks like it, squawks like it, but it's hard to say, yes, this is it, and this is how severe it is. If we can see, radiographically or even using computed tomography, CAT scans. If we can see that, then that's good. But usually those are severe cases, and so you look at some of the. So you say, well, it's associated with cholesterol. So if the bird has high cholesterol, we could treat it. Unfortunately, some of the work and Dr. Hugues Beaufrère at the University of California, Davis now, he was one of the first to actually kind of classify and define and show the significance of atherosclerosis in parrots. And he's done some studies on like Lipitor to reduce the cholesterol. Unfortunately, Lipitor does not seem to be a drug that can get to therapeutic levels to be beneficial in parrots. So that's one of the things that is problematic. And so you get down to the initial treatment. The initial treatment comes down to, at this point in time, is if you want to try to reduce the chance of the bird having atherosclerosis, is good nutrition, and going in and having good nutrition and reducing the amount of fat within the bird's diet. And that's going to be, if you want to know what the first treatment is, and we're getting back down to it, Laura, that would be it. Initial treatment is prevention on that. And that's it comes down to a simple answer, but there I like to have an explanation behind a simple answer.
Very thorough. That's right. You checked all the boxes. All right. Okay, I got a next question here from Pat. They heard that a bird cage should not be in front of a window, and they're saying their cage is in front of a window. So what is your thought on this? Can birds' cages be near windows?
Okay.
Where's your bird cage?
Why should a bird cage not be in front of a window? I guess that's the main question, right? On this one, why should a bird cage not be in front of a window? And I will just give you some of my thoughts on the answer to that, why somebody would question putting a bird cage in front of a window. From my understanding is that birds in a sense could feel exposed in front of a window, and if there's no place to hide, that would be somewhat stressful on that. And I will that's my kind of understanding of that issue of putting the bird in front of a window with no place to hide or what have you. Then I kind of, there may be something else there. I just don't know. And then I think about putting my bird outside all day. Now, again, I bring my bird back in. So is it, well, you don't have it out in front of a window all the time. So it does have, that's just part of the time. But I'm sure people do that, take their bird out and put it out and then bring it back in. But I think if you put it in front of a window, if the question is that the bird doesn't have any place to hide or what have you and feels exposed, then if you're concerned about that, then just to have an area within the cage that the bird can go and feel like I'm not exposed, and that if I'm here, something can't get me or what have you, or if something comes in front of the window that it's concerned with or frightens it, that it can get away from. So that's my understanding of putting a bird cage in front of a window. And yeah, I have heard that.
Mhm.
And but yeah, and again, if the bird is there and is experiencing some type of behavioral issues, then that may be something to try to address as far as location or something in the cage for the bird to hide. It may make it better.
Okay. Okay. I'll throw in my word of caution. When I was younger, when I was little and I had my cockatiel, I had his cage in front of a window. And I'd let him, kind of come, like, have his door open to be on the edge of his cage. And then I come to find out that he had been meticulously excavating this window screen and nibbling a little hole in it, enough to almost escape. So
Yeah, I've seen a movie about that, Shawshank Redemption.
yes, it was like the cockatiel version of you never know. That's funny. He'd cover it up at night and back to the day. So
Yeah, dropping the screen pieces on the bottom of the cage.
yes, and hiding it with the all right, sorry. Okay, we have a question from Eileen, who has a 27-year-old lilac crown Amazon that was diagnosed with avian ganglionitis in September. So it was on Onsior for 6 doses and now is on Celebrex twice a day. She's back to a baseline health behavior-wise. Do you recommend Celebrex for life now that she's doing well? And can Celebrex be used long-term, being used long-term cause any health issues?
Yeah, any therapeutic agent long term can cause health issues, any. That's why you don't want to get on long-term medication. Unfortunately, for humans and others, the good outweighs the bad. And so and just for my cases, I'll just say for my cases, I if I can take one of my patients off medication, I will, when it's not needed, and whatever those parameters are, based on what it comes in with, whatever the condition, whatever it's been diagnosed with. If the bird is recovered to a point where it's functioning and has a good quality of life, and the presenting problem or the problem being treated is kind of quiescent or in remission or whatever you would want to call it, or treated or resolved, then naturally I'm going to try to do what I can, whether it's pain medication or whether it's anti-inflammatory medication, as in this, or antibiotic therapy. So the on these type cases, it's talk with the veterinarian. Your veterinarian seems to be handling this case really well, and based on everything that you've mentioned, and assess that as it goes forward. But as I've always mentioned, anything that you take has this many negative effects and only this many good effects. That's what you use it for, this good effect. And all of these other side effects are possible, right? And the longer you have it on medication, the greater chance you have of actually having one of those side effects. So I like to reduce that and make sure that we only get the good effect and mitigate or reduce the chance of having any of the side effects. So it's how the bird responds, and with the treatment depends on how long that is. Unfortunately, in some cases, it has to be lifelong. And then it's like older humans on blood pressure medication, what have you. Your unfortunately, your arteries just aren't as flexible as they were when you were younger, as we were when we were younger, and you have to have medication to make up for that. But that's the case in such as this, monitoring your little Amazon and seeing how it does and the response, and if you have the ability to see how it does. Sometimes you're surprised at how well the bird does off medication, and then and sometimes it's like, whoa, we need to get it back on the medication. The medication is actually providing the allowing the bird to live. So that's my thoughts on that.
Okay. Ooh, we have a question about microplastics in bottled water, because that's a recent study, right? In filtered water as well. So they're wondering, is tap water better given what is known about plastics and these other sources? So is it better to give tap water now that it's microplastics in bottled and filtered water?
Oh, I that's a great question. That's a great question, because we don't want to know how much plastic we ingest. We don't even want to know. And so we can't, at this point in history, we can't keep it out of ourselves or our birds. Okay. The question then becomes bottled water, and this was always the what I've thought about bottled water, well water, what have you. It's better than tap water, and or how does it relate to tap water? So this is a great question.
Mhm.
And the one thing that I would say about tap water is that I would say that I would always when I talk about tap water, I'm talking about filtered tap water. Okay, because not everybody has filtered tap water, but I think that your best bet to have the best, to have a what I say, the quality to ensure is the quality of the tap water is that it's filtered, because there's a lot that occurs. Tap water in and of itself in most places is highly tested and controlled, but we know of places and situations where there's high lead levels in tap water. Flint, Michigan, I have to say that because that may and I know that they're doing everything they can to help that, but it was known. But it's a problem not there, but also where there's in older places with lead. Some of the filters are very good at filtering some of the tap water. The majority of tap water is fine, but filtered tap water because they do a lot of things with it. Bottled water, I would say if you have good tap water, not every place that's the case, but if your community has good tap water that's filtered, I would say personally that it's the same quality as you're going to probably find in that bottled water. I would say that, yeah, because of the testing and everything that's done on that tap water. And the filtering takes out any inconsistencies if they have a broken line or change and something happens. But the filtered tap water is as good as the bottled water that you purchase. Then you have the microplastics. I'd like to think that the microplastics and the quality of the tap water that in the bottle, it has to be drinkable, but that's something that is as unknown as but I'd say that your tap water is probably, you can find out exactly what's in the tap water from the last testing that was done by your community. But you can't necessarily at the bottled water. The microplastics, this gets into a situation where microplastics are microplastics. And you go like, well, that sounds pretty, intelligent. Microplastics are microplastics. Well, they're finding microplastics at the very top of mountains in snow.
Yeah.
Okay. At the very top of mountains in snow. So they get snow and there's microplastics in there. So are microplastics in your tap water? Probably, so we can't get away from microplastics at this point in history. And so what it boils down to is that, no pun intended, is that
Really fun.
that you probably it's probably there's probably a little difference between the microplastics you get in your tap water and the microplastics you get in a bottle. Maybe so, but somebody from a community said we don't have any microplastics in our tap water, but I'm reading where they're finding microplastics in beer and all kinds of things like that. So yeah.
Microbreweries,
Yeah, microplastics in microbreweries. Yeah.
Oh boy. Okay. So, hey, question from Jim about is a gram stain test an adequate screening for avian gastric yeast?
You can, as so a gram stain, you can do a gram stain on a fecal sample, or you could take a swab and you could swab the crop. Avian gastric yeast, megabacteria as it was once called, but avian, it's still called that, but avian gastric yeast, Macrorhabdus ornithogaster, if you will, likes to live between I guess it's said, what's your preferred site? If you're walking down the street and you saw a big avian gastric yeast walking by, you would say, where would you like to live? And that avian gastric yeast would say, I really like to live between the ventriculus and the proventriculus. It's the isthmus, the area between those, the stomach and the true stomach and the gizzard, that little connected area. That's where it really likes to live. But of course, you could find it in the stool. You could find it in the crop, because it'll shed, with that. But as far as the the gram stain, we can only gram stain like the crop or the crop or the stool or the cloaca, okay? Or we can do a combo. We can do the crop, then we can take that same swab and do the cloaca and then get some feces and do a combo swab and then smear and then do a gram stain on it. Unfortunately, that is not a definite. We have with testing, you have sensitivity and specificity. Sensitivity is how often that we would, how often that we would find it if the bird truly had avian gastric yeast. Unfortunately, the sensitivity of that is not really good. We don't have this is very a good chance if it does have it that we would have a negative. It would be a false negative though. But it's very specific. If we see it, it's there, right? But unfortunately, it's not very sensitive. So, but that is about the best we can do as it relates to trying to determine if the bird has it or not. And of course, we're doing those tests normally. We could do it if the bird is just to screen the bird, but unfortunately, it's difficult enough if the bird has signs that are associated with avian gastric yeast, regurgitation, going light, and the fact that it's eating. Even if we, it says, well, it looks like it, we believe that these signs are consistent with avian gastric yeast, say on a budgie, and we test with the gram stain, and it's a negative test. It doesn't necessarily mean it is negative. So it's a test we use. We have to use it. It's good if we can pick up the organism and it's shedding the organism when we do it. So hopefully that helps a little bit.
Sure does. Yes.
I wish it was a better test. Whoop, there it is.
That's what we got. So we got to work with. So Carolyn says they have a 2-year-old Linny he's picked his chest like ab area, and the labs revealed that he had lead poisoning. There are objects in the abdominal area. So after medication, he's been declared free from lead. He's still picking though. So the questions to you are, the vet recommends giving medications to essentially poop out the objects. And how much feather loss per day is considered excessive? Other than the feather loss, he seems fine. So we got a little Linny recovering from what appears to be lead poisoning. How common is lead poisoning? Do you see that much in your line of work?
I see it too much. And I think, I think I've shown you some of these things that we have had that people, have.
Oh, yeah.
Where the little bird has really liked to nibble that. And then this was in the cage right here. You can see.
Oh, like a fishing weight.
Yeah, that was in the cage, and the birds really liked it. That's just a couple of things that I look at from time to time to remind me. But lead toxicity is it's not uncommon. I like that phrase, not uncommon. And we do see it. The one with lead, you have to get blood samples to determine if the bird has lead toxicity or not. Just seeing something in the GI tract that is helpful, because until that leaves the GI tract, the stomach which would include the ventriculus or gizzard, then the bird is always getting lead until that leaves the GI tract. And so, but you can have lead toxicity of birds showing and exhibiting signs of lead toxicity, neurologic signs, or that the bird can't perch or is a little ataxic. And so you can have birds with lead toxicity, and you can take a radiograph and see nothing in there that would be metallic or indication that there would be lead. So blood lead levels are the way to determine, one, if the bird has it and how significant it is, and three, if the bird is actually clear of the lead within the body. Okay, or there's no more lead, or the lead levels are considered normal on that. We shouldn't have any lead in our body. Our body can't do anything with lead, but we do because it's in the environment. But there are levels that you can live with that do not cause any disease signs, and there are levels that are considered normal levels in birds, and that's what the blood lead does. And that also gives you an idea, is the bird toxic, even though we don't see any object in the stomach, you see.
Oh, they're saying, sorry, that the second set of x-rays showed that the Lenny still has objects in his body.
Right. And so if they as long as they're there, the bird is absorbing lead. And if it is proven to be lead, then they will have to, the veterinarian obviously is doing what they can to move the objects through the GI tract. And if it's small enough, they'll pass, but sometimes it takes a while for that to occur. And so that's and until they are gone out of the body, the bird's going to need to be on therapy. In that therapy is not necessarily where you give it every day until it's gone. You can do it in increments to get the levels down, and then take it off the medication, put it back on, depending on how the if the objects are there. But as long as they're there, that has to be monitored and watched. And naturally, anytime that occurs, and I feel for the owner because I want them out of there like that, gone. Unfortunately, that ventriculus is, the gizzard is one of those things that just kind of grind, right? It grinds the food and kind of goes in circles. And sometimes it just takes more time to pass than it does otherwise.
Okay. And if it can't pass it, is there a surgery option? Like, is that what we would?
Oh, there is, but we're talking about a linealated parakeet, aren't we?
Yeah. Okay. Sure. Yeah.
Yeah. And so that always is the challenge for avian veterinarians. You want to treat birds? Here's a 50-gram bird for you to work on. Here's a 30-gram bird for you to do surgery on. And we always want our patients to be awake at the end of surgery and get ready, get back home. And so we have to weigh all of this. And so surgery, when you're looking at surgery for larger birds to remove a foreign body from the GI tract, you could go in with an endoscope and look at it and say, there it is,
Mm.
grab it, take it out. Or there are, you could do a ventriculotomy, and then you have to go into the body cavity, go and see where the ventriculus is and remove the object from the ventriculus. And it's easy to do, is easier to do those on ducks or geese, or even large macaw than it is to do it on a 30-gram bird, a 40, 50-gram bird. Yeah. And so, unfortunately, you're at a point where you have to look at the chelation therapy. And for the most part, I will say, think positive. I like positive thinking. I'm a positive thinker. And I wouldn't be an avian vet if I wasn't, right? You have to. And so, you know, your veterinarian seems to be doing a good job. Just, you know, let's get that metal out of there. Let's
All
get,
right. Get the metal out. Get the lead out. All
yeah,
right.
get the lead out.
Oh man, okay, that was good. We covered some interesting questions today, but our time, we are past our time, so I gotta announce our giveaway winner today. And this is we're gonna give away some Avicakes. Some people say Avicakes, Avicakes, Lafeber Avicakes, as well as another Lafeber product of your bird's choice, and that is going out to Amy Farina. Congratulations, you are.
Thank you, Amy. Yeah,
Yay.
congratulations. Fantastic. Fantastic.
Hopefully that makes your weekend. So next month, I'm gonna give you a sneak preview. We're marching into March. So we are going to do some timely topics for March, and that's our first 3 webinars out the gate are going to be on hormones. So we've got Pamela Clark talking about hormones, Lisa Bono is gonna be talking about hormones, and Dr. Lamb is gonna be talking about hormones. So those are the first 3 Fridays in March, and then Dr. Tully will be on with you on the last week of March, the last Friday of March, and I'm sure we'll have some hormone questions for you too. We'll never know what you're.
Yes, great. Hey, fantastic questions. I want to thank all of our webinar guests here. I'm telling you, it was fantastic, Laura. Great questions, always new questions, and we even old questions, you know, to touch base, but fantastic, and love it. I really appreciate it. Really appreciate it. Great.
Appreciate your time as well. So yeah, thank you for joining us, and we'll see if we can come up with another Stump Dr. Tully question next episode, because then you'll get back to us like you did with the lights today. That was super.
That's right. That's right. Always. I had it ready.
Had it out there ready. All right.
So
all right, guys. On that note, I'm going to wish everyone a fabulous weekend. Everyone stay safe. All the best to you and your flock. And until next time, bye.
Yes. Thank you, Laura. Brenda Lafeber. Bye-bye. And now.